Some other components of healthcare reform are what are called insurance exchanges. These actually come into effect October 1st of this year, so only a month from now. So this is to help small businesses buy policies. So if you're a small, large employers, like if you look at the state of South Carolina, they can spread their risk among many, many employees. If you're a small business and you have someone who's gotten sick, you may pay a higher premium as a result of that. So this is to help small businesses buy policies to insure their workers. There are increased consumer protections where people can go for appeals for denial or coverage of services. So in the past, sometimes people could not appeal any of their healthcare decisions. And here's an interesting piece, although this varies too. Coverage for preventive care must be fully covered without deductible or coinsurance. So there are certain screenings such as mammograms, which that has been a federal law for other times. So that's with the birth control that has been really controversial, and some other preventive screenings. What you have to keep in mind is that not every plan has had to do that. Some plans are called grandfathered plans. So even though this has already kicked in for preventive care, that you would get an annual physical exam or an annual women's GYN exam covered every year, certain large employer plans do not have to follow this. And our state health plan is one of those plans. So it's important to find out when you're going for a job, is your plan covered under this preventive care policy or not? Or are they what's called the grandfathered plan, where they don't have to adhere to that? So it's very frustrating to go to the doctor and thinking that you have these preventive services covered, only to be stuck with, what could be a very large bill to find out it isn't actually covered. So that is a little bit of controversy. It's great for people who've had it covered, but there are a lot of large employer plans where that is not covered. Another part of healthcare reform is the National Prevention Strategy, and I know some of you are going to be presenting on this. Healthy communities, worksite health promotion, funding the community transformation grants, such as the one we have through York County called the Healthy South Carolina Initiative. So access to preventive and clinical services, make healthy communities, eliminate health disparities. So that is where certain racial or ethnic groups are more prone to a disease. Once again, sounds like a great strategy, but it's controversial. So these are the 7 priorities of the National Prevention Strategy. Of course, we're doing a lot through our Eat Smart, Move More York County group, our Healthy South Carolina initiative, tobacco-free living, healthy eating, active living, our workplace lactation rooms, trying to improve the walkability and bikeability around Rock Hill. So these are really, really important, and your classmates will be presenting about some of the controversies about this. I'm not going to cover the insurance plan pros and cons, because I would like to cover this in class and really go through the discussion. A lot of you are going to be graduating very soon, and you may have a choice of plan where you are going. So you need to understand the basic mechanics of what each of these types of insurance plans is about. On the other hand, you may not have a choice at all, and you may be working with a business that says, we have a health maintenance organization, or we have the high deductible plan only. So you have to understand what that entails so that you can make the best decision for yourself and your family. So we'll cover this in way more detail in class. So the key is you have to understand the legislation as it relates to special populations. It's also going to affect you. It's going to affect your life personally and, likely professionally as well. It impacts facilities, programs, it impacts people, it impacts your bottom line. And, it can provide jobs. The one good thing, healthcare careers are very stable. And a lot of it has to do with the passage of healthcare reform. And there are fundings to make communities more walkable. There are lots of initiatives for that. There are lots of grants to help people with disabilities. So we've come a long way, but we've got a lot more work to do in this area. And then we will go through the sample question in class on Thursday. Thank you very much.